Welcome back to my channel. To you, my returning subscriber, thank you so much for always clicking on my videos. And if you are new to my channel, you are welcome. Okay, I'm Tessie by name. So in this video I'll be talking on urine analysis or urinalysis. Okay, some of us, when we do our laboratory test, we see urinalysis is one of the routine tests in the laboratory. Okay, but it has a lot of information with it. So I'll talk extensively on this urinalysis. So what is urinalysis? Urinalysis is the physical, the chemical, and microscopic examination of the urine. Okay, so generally this urinalysis will indicate the state of the kidneys. It will provide information about the metabolic and systemic abnormalities. It also tells when there is urinary tract infection. Okay, so normal urine is just a fluid that contains water. It contains soluble waste products that is being excreted from the blood, okay, through the kidneys. So normal urine is made up of about 75% of water and 5% end products of metabolism, such as urea, uric acid, creatinine, sodium, potassium, chloride, calcium, phosphates. All these are being suspended in urine. So the composition of this urine, okay, it varies from day to day depending on the food we eat and the fluid intake. So that is what determines the volume of urine we pass through in a day. So for this urine analysis, if you are to do this test, the urine sample should be collected in a chemically clean and dry container. Okay, so if you can remember, most of the times when you are to run any urine test, be it urine analysis or urine culture, when you come to the lab with your urine samples, most of the time the sample is always being rejected. Okay, they are not rejecting those samples to make things difficult for you. There are some things that needs to be considered, like the container you use in providing that urine sample. You don't just use anyhow container and wash it and use it to bring your urine sample. It will affect a lot of results. So that is why they have a container called universal bottle. It's always sterile when it comes to getting urine samples. So it must be examined as soon as possible. Even if you should produce that urine as in early morning, like most of us know that is early morning urine sample that is always preferable for any urine test. If you provide that, if you produce that urine in the morning hours, but before you get the sample down to the lab is maybe getting to the noonday, it will be rejected because a lot of things must have happened to that urine. So that urine, on standing, some of the constituents may be lost to decomposition. So it must be examined as soon as possible. Okay, things like red blood cells, white blood cells, they are being destroyed. Even cast, they are being decomposed, and if there is glucose in that urine, it will be lost through the process known as what? Glycolysis. So there will also be bacterial decomposition, bacterial contamination. There will be increase in the pH of the urine. Okay, so that is why it's good to make sure that the sample is being collected in a chemically clean, dry container and it gets to the lab as soon as possible. Okay, so the next thing is which urine sample is ideal. Like, what is the ideal urine sample for urine analysis? The ideal urine sample is the first freshly voided early morning urine. Okay, that is the most reliable specimen for examination of mucus, pus, and other cellular elements. So it is also of value when it comes to pregnancy test. Like most of us, we know that we can still use our urine to test for pregnancy test. So it is this same early morning urine that is being needed. And also if fasting glucose level is being assessed, this same early morning urine is ideal for fasting blood sugar. You can also test your fasting blood sugar through blood test or urine test. So this urine analysis, okay, it is being divided into three. We have the physical examination, okay, we have the chemical examination, and microscopy examination. So when it comes to physical examination, we have things that we check out for. You check the color of the urine, you check out for the transparency, you check the odor, okay, you also check for the volume and specific gravity. When it comes to chemical analysis, you have to check for the pH of the urine, you check for the glucose, you check for protein, you check if there is blood in that urine, you check for ketones, you check for bilirubin and urobilinogen. Then if you are viewing the urine sample under the microscope, there are some things you need to check out for. You have to check if there is red blood cell in that urine. You have to check for white blood cells, okay? You check out for epithelial cells, you check out for cast and bacteria. So today I'll be explaining more on the physical examination of the urine. So the first one is volume. You have to check the volume, okay? So the volume of the urine that we excrete daily, it depends on our fluid intake and diet. Climate also affects the volume of our urine. Like when the weather is during rainy season, okay, we always experience that there's always increase in urine output, okay, and there are other physiological factors too that can affect the volume of urine that one produces in a day. So out of the 75 to 150 liters of as in the urine that is being produced through the glomerular filtrate, okay, is only around 1 to 2 liters that is being excreted as in urine output, okay. So when there is increase in the volume of urine, as seen in diabetes mellitus, diabetes insipidus, okay, it is known as polyuria. That is, polyuria is when somebody is excreting more, when you are producing more urine above normal, okay. Outside these are normal physiological factors like that climate I mentioned before, fluid intake. Like when there is increase in urine output, it is known as polyuria. So oliguria is also a disease where the volume of the urine that someone produces in a day is lesser than normal. There are some people that they don't even produce up to a liter of urine in a day, okay. So as seen in hypertension, like people with low blood pressure, and in acute glomerulonephritis, okay. So these are the conditions that can make someone to have a decrease in urine output, okay. Then another thing you should look out for when it comes to physical examination is to check for the color of the urine, okay. So normal urine is clear, like it's clear when it is freshly voided. It is pale to dark yellow. Dark yellow is amber, okay, that is amber. It is pale to amber in color due to a pigment called urochrome and urobilinogen. These are the two things that gives our urine that amber color. So when it comes to cloudiness in freshly voided urine is of clinical significance. Like when somebody just passed urine and you notice that urine is somehow cloudy or turbid, it may be as a result of blood in that urine, or pus, or bacteria. There are a lot of things that can make someone's urine to be cloudy. So it's very important to get that urine examined to know why that urine is cloudy. Another thing is the abnormal appearance of urine in some pathological conditions. There are some disease condition that can make the appearance of urine to change. Okay, so for instance, one of them is urinary schistosomiasis. This one, when somebody has this disease, this urinary schistosomiasis, it may give rise to bloody urine. Like when you see the person's urine, it will be very bloody. So schistosomiasis can cause urine to be that cloudy and bloody. Then in severe jaundice too, like when somebody has jaundice, the urine may appear orange yellow or yellow to green brown, that kind of color. Okay, so it means that there is increased excretion of bilirubin, and urobilinogen in the urine. So another thing that can make the color of urine to also change is when it's in black water fever. Yeah, in black water fever and other intravascular hemolysis, the urine appears brown too, and it also appears cloudy due to increased excretion of free porphyrin. So these are the things that can make the urine appearance to be cloudy. Okay, there are some other normal conditions where urine can also be blood, like when a female is menstruating. Okay, the urine will be bloody. So that one, there is no disease condition causing it. It is normal. So outside when a young lady is menstruating and the urine is somehow cloudy, and in male too, when the urine appears cloudy, it's good to do this urinalysis test. It is a very simple test. It is a routine test, but it will give you a picture of, as in the state of the kidney. Okay, it will tell you if someone has urinary tract infection. It is a screening test, so you can see that it has a lot of significance. So in my next video or in my subsequent videos, I'll still talk on the chemical part of it, because we just explained the physical part of the urine analysis. So when we talk on the chemical part, you see that through that chemical examination, you'll be able to know if that urine, if it contains glucose, if it contains protein, if it contains blood, ketones, bilirubin, urobilinogen. So it is when urine analysis is being done and you notice that this urine contains sugar, or it contains bilirubin, that is when you now go for a comprehensive test. For instance, assuming that you tested someone's urine and you notice that there is sugar in this urine, the next thing is to do fasting blood sugar for that person, or you do oral glucose tolerance test for this person to confirm if what is present in urine is also what is really happening. Okay, that is the confirmation test now. So that is for the sugar part of it. Then another thing is when you do urine analysis and you notice that there is blood in this urine, you have to do a comprehensive test to know if this blood is as a result of someone menstruating, or is there anything that is wrong with the kidney. Okay, that is another thing you have to consider. And another typical example is when you check somebody's urine and you notice that there is bilirubin in this urine, you need to confirm that patient sample by running liver function test to make sure that is this bilirubin as a result of liver problem, or maybe this person took certain drug. So that is why urine analysis is a simple test, but a very detailed test that will give you a clear picture of what is happening in the kidney. Thank you for always watching my videos. Thank you once again, and see you in my next video. If you haven't subscribed, please subscribe. See you.